And welcome back. The questions still coming in about COVID-19 and the state's response. We are continuing our live conversation with Dr. Benjamin Chan via Skype to answer your questions. And so here we go with another. Sandy asks, do you feel that everyone should be wearing a mask or face covering when they go into stores and other public spaces? Shouldn't it be mandatory, not recommended?
Yeah, so the Centers for Disease Control and Prevention and we as well recommend that people who are going out of their house and visiting facilities or stores where social distancing might be difficult, that those individuals wear at a minimum a cloth face covering. There's instructions online through the CDC website for how people can make these cloth face coverings themselves. They can be fairly simply made, but we do recommend that people, when they're out in public places where social distancing may be difficult, that they wear a cloth face covering to prevent other people from coming into contact with respiratory secretions, saliva, when people are out in public.
Aaron asks, assuming a person has recovered from a moderately severe case of COVID-19, what are the possible long-term effects someone might suffer from?
Yeah, so this is a new virus, right? We just started learning about this literally 4 months or so ago. And so the long-term complications of this virus are still being studied and researched. The majority of people who have this infection will have more mild symptoms. They won't need to be hospitalized, for example, and will likely fully recover. We believe that once someone is infected, they likely have some protection or some immunity in the short term. But how long a person's protection lasts for after they're infected, I think, is still being studied. We don't know whether someone's protection might decrease or wane over time, as we see with some viruses. But the majority of people will have more mild symptoms and should recover.
Okay, Jennifer has two questions. First, if one member of a household was positive and out of isolation, and then another member of the household ends up positive later, is it still okay to be within 6 feet?
Yeah, great questions. So these are the kind of detailed questions that we've been getting in at Public Health, and sometimes they can be difficult to answer. I think that the answer really depends on the specifics of a person's situation. We have seen COVID-19 be able to be transmitted within households from one person to another, and so it's not unusual that one person might be infected, get better, and then some period later, usually within a couple of weeks, another person becomes infected. It sounds like that's the situation this person is describing. And there is guidance on the CDC website for how people within a household should be managing themselves and caring for the person who is sick. And so we would certainly direct you to that guidance. And if you have questions about your risk or another person's risk in the family, please be reaching out to either your primary care doctor or the public health department here, and we can talk through some of those situations.
So Jennifer also wanted to know, how should you clean an isolation room? Do you need to wash all the clothing that may have been exposed in there?
So I assume Jennifer is asking about this in the home environment. And again, if someone is sick in the home environment, there are pretty good instructions on the CDC website for how people can be cared for in the home environment. And that does include cleaning and disinfection, guidance. That would include, cleaning frequently touched surfaces, doing frequent laundering. The details of those are, spelled out online on the CDC website. But in general, yes, there should be cleaning and disinfection that occurs in the household of someone who's diagnosed with COVID-19.
Doctor, you're terrific. We've got a whole stack of questions still ahead. We'll be right back right after the break.